This is Dr. Ronald Ritchie, and welcome to the video I call What's Wrong With Me? I Hurt All the Time. This is about arthritis and chronic inflammation. Wow. This is a picture of an individual with rheumatoid arthritis. How can anyone have comfort or function with hands like these? And yet it happens every day. And even more commonly, here's an x-ray of a knee of osteoarthritis. This person here has almost bone on bone right here on the medial side or the inside of the knee. And this is a right knee. You can see by the little R marker right there, showing that the bone is the cartilage is almost completely worn away to bone. This is arthritis. Well, what is arthritis? By definition, arthritis is inflammation of joints that lead to deterioration or damage of those joints. And there are many types and many causes because of the different types of arthritis. A common one we hear about all the time is rheumatoid, and you remember that picture from the previous slide. Rheumatoid arthritis is what's called an autoimmune condition. And autoimmune just means our body's immune system attacking itself. This particular variety of autoimmune disease is where the body attacks connective tissues around the joints, and eventually that damage causes overgrowth of the bone and of the soft tissues, producing rheumatoid disease. Another type of arthritis is called osteoarthritis. This is by far the most common form of arthritis, and it can either be regional, like just in one area of the body, like the neck or the back, or it can be systemic, affecting every joint all over the body, much like rheumatoid arthritis. There is gouty arthritis, and that is from excessive uric acid in the body through either just excessive consumption of urates of substances that create uric acid in the body, or the inability of the kidney to get rid of all that uric acid. And what happens is the uric acid crystallizes in tissues, especially in the feet, the big toe, and the knees, causing this form of arthritis called gouty arthritis. Psoriatic arthritis is another one of those immune system problems, although it's not autoimmune, and it usually goes along with psoriasis of the skin. There are a lot of treatments for this, including biological medications that cause the immune system to change how it functions. But psoriatic arthritis is an increasing prevalence of disease these days. And lastly, we have degenerative or inflammatory arthritis. This is really a form of osteoarthritis, but this is usually the consequence of some type of damage or injury to joints that produces a localized osteoarthritic change. Well, what's the root cause of all these forms of arthritis? Well, it is a problem within what's called the cellular phospholipid bilayer. Now that's a big mouthful, but right in here in the cell lining of every single cell of the body, there is a process that goes on when inflammation occurs. And this is called the arachidonic acid cascade. That is, there is a triggering of this substance called arachidonic acid in that cellular phospholipid bilayer that creates a domino effect that affects a tremendous amount of chemical substances in the body. Well, we don't know these names very well, but you certainly do know this one right here called COX. Anybody ever take Aleve, Advil, ibuprofen, naproxen? Well, you have taken what's called a COX-2 inhibitor, and it affects these substances right here called prostaglandins that then changes how our body acts in inflammatory conditions. It slows down inflammation. A little bit more complicated picture of this same thing, but what happens is that those medications affects COX-1 and COX-2, which then affects all of the outflow from that, which generates a change in the inflammation that is occurring within the body because it changes the inflammation within a cell. Well, there are other substances that affect lipooxygenase, cytochrome P450, and free radicals that we also know as various injectable medications, biologics, and oral medications. What's the differences? Well, arthritis usually affects joints primarily. That's arthros, meaning joint, itis, inflammation, inflammation of joints. So arthritis predominantly affects joints. It usually has an underlying cause. There's something, whether it's autoimmune like rheumatoid disease, gouty where there's excess of uric acid, trauma such as a post-traumatic or degenerative arthritis, or generalized or regional osteoarthritis. There's always some underlying cause. But usually also it causes the joints to deteriorate. It damages the joint structure in some way that causes deterioration or degeneration of a joint. Chronic inflammation, though, both of these going through those same arachidonic acid problems in the phospholipid bilayer of cells, can affect any tissue. If you've ever heard of myofascial pain syndrome or fibromyalgia, you can think of that as arthritis of the muscles because it's chronic inflammatory processes going on within the muscles rather than within the joints. But it can affect any tissue: blood vessels, muscles, tendons, ligaments. Anyone here ever hear of somebody having a frozen shoulder or chronic bursitis or tendonitis in a shoulder? Well, that's chronic inflammation involving the muscles, the tendons, the joint capsules, in addition to the joint structure. Well, and it usually does not deteriorate the tissue, although it does cause fibrous change within that tissue and make it very stiff and immobile. And unlike arthritis, where there's usually a more direct, singular cause for the arthritis, with chronic inflammation, there can be and usually are multiple underlying causes for that inflammation. And those causes can be anywhere from genetic predispositions, like people in families just have a tendency for that problem. It can be an association of other associated diseases like COPD or diabetes or kidney disease. And it even has a connection to our environment, the kind of environment we live in and work in, and also even the diet. One of the things that's interesting and is being noted by researchers is that chronic inflammatory diseases, as far as a classification of illness, is increasing rather rapidly in America. And the reason for that is because Americans consume about 3 times the amount of sugar of any other population in the world. And that consumption of high levels of refined sugars is a fueler of the fire of chronic inflammation. Anyone who has diabetes knows that high blood sugar levels makes inflammation worse. Well, what's the problem? Far too often, once diagnosed, people are pigeonholed. That is, if a person is diagnosed with rheumatoid disease, doctors typically don't look at anything else. They think every pain they have is a consequence of their rheumatoid disease. And that's not necessarily so. With arthritis and chronic inflammatory diseases, these are whole person conditions, not just a disease state. So if a person has back pain and they're diabetic, well, the doctor will often say, oh, well, it's just weakness in your back because you have diabetes. Well, that's not necessarily so. Or if a person has been diagnosed with fibromyalgia, and the doctor says, well, your shoulder pain or your knee pain is because of your fibromyalgia, that's not necessarily so. There may be something else going on, but they have been pigeonholed into that diagnosis, and they're not looked at as a whole person with a potential arthritic or chronic inflammatory problem that does not relate to that primary diagnosis. And with arthritis and chronic inflammatory disease, it is a multifaceted problem. That is, it's not a simple thing, and there's not a simple solution, and there is not a simple treatment, and it requires multifaceted care. You can't just take a person with those kinds of conditions, especially chronic inflammation, and just throw one medication at them and say, oh, you don't have to do anything else like change your diet or change your activity or get better sleep or something like that, which most all of those are involved. You just can't throw a medication at them and expect it to fix the problem. It won't, because it's not a simple problem. Well, what's the treatment for these things? Well, like I just said, medications are commonly used as the primary and most of the time the only form of treatment. That will be in the form of analgesics, pain medications, anti-inflammatories such as ibuprofen and naproxen, and prescription anti-inflammatories also. Antidepressants are now being used quite prevalently in the treatment of chronic inflammation. And why not? Because if you've got chronic inflammation that's not responding to treatment, and the doctor isn't looking at you as a multifaceted, multi-directional condition, and all they kind of do is give you the pain medications and the anti-inflammatories, of course you're going to be depressed because you're in pain all the time. You're not sleeping well. You can't enjoy life and get engaged with your family or even with work. You go to work all day, and when you get home, you hurt so bad, you're in so much, and you're so uncomfortable, and you're so tired that you can't do anything. Who wouldn't be depressed? Well, unfortunately, that's what happens much of the time, is that because of the failure of treatment and an unwillingness to take that person out of that pigeonhole and look at them in other ways for other possibilities and other care that could be given, the patient's condition stays where it is. The treatment doesn't really work. It fails, and people end up on antidepressants. And then, lastly, immune modulators. And that's things like the injectable biologics that you see a lot advertised on TV for various chronic inflammatory diseases such as rheumatoid arthritis and gouty arthritis and psoriatic arthritis and irritable bowel syndrome and Crohn's disease and all these other things that you see. Those are biologics that modulate the immune system. So instead of trying to fix the immune system or fix the allergic or the immune load that's on the body, just give them a drug that alters their immune system's function. Well, that's a Pandora's box that yet is to be opened all the way, and somewhere in the next 15 or 20 years, we'll find out what's going to happen to people when they do this. Physical therapy. Well, I don't want to discount physical therapy. I use it myself in my office, and I think physical therapy and its various aspects are quite good. But with people with a lot of arthritis and chronic inflammatory disease, they're limited by the patient's capacity to perform the exercise. And the other thing that's also true, people with chronic inflammatory problems usually lack the drive to work physically hard to hurt worse before they get better. There are many injections that are done these days, and really honestly with arthritis and chronic inflammatory disease, they have a 50-50 value, and each injection gets fewer and fewer and fewer beneficial days following the injections. You get to the law of diminishing returns, and after the third injection, there just is no benefit, and so we lose the capacity for those injections to work. And lastly is surgery. In chronic inflammatory diseases, there aren't very many surgeries that are done unless it's to do joint replacement surgery. Well, when you replace the joint, you get rid of the damaged joint, but you still haven't got rid of the cause of the inflammation. So what happens? The inflammation just pops up in other places of the body, causing damage to those tissues also. Well, what's the chiropractic approach to address these? First of all, the adjustment, the spinal manipulation or the manipulation of a knee, an ankle, a shoulder, a wrist, fingers, a TMJ. There's manipulation that can be done to all these joints, which helps improves their biomechanics, improves their overall motion, and gets more free motion with less inflammation in those surrounding tissues. Physical therapy. Well, the difference is we focus upon myofascial release, and that is a form of stretching and active work therapy on muscles, tendons, and joints that improves their overall physiology and their dynamics to improve body posture and biomechanics and improves range of motion and eventually strength. Exercise. This is not generalized exercise. This is exercise that is specific to the patient's need. What does that patient need for that particular problem? Not just go to 24-hour fitness or some gym somewhere and say, just go exercise. Or just walk. That may not necessarily be the right thing for that patient. Then we get to something that is becoming more prevalent, but is still not used properly by most doctors, and that is nutraceuticals. Nutraceuticals is kind of a made-up word. It simply means nutrients like vitamins, minerals, herbs, amino acids, essential fatty acids that are used therapeutically at therapeutic levels to reach specific goals. This is not going down to your local vitamin store or nutrition store and letting some high school graduate tell you, well, these things work really good and the manufacturer of this product says you should take this. No. This is specific training and knowledge in therapeutic values and uses of vitamins, minerals, herbs, amino acids, and essential fatty acids. This is not just something simple. This is medication use of nutrients that have specific goals, and this requires very specific knowledge. Nutraceutical therapy is more complex than medications. It is definitely much more complex and a multifaceted therapeutic end to reach those therapeutic goals on patients with chronic inflammation. And lastly, diet and lifestyle changes. I'm telling you, if you don't change your diet, if you don't change your activity, if you don't improve your sleep patterns, if you don't change things in your life that are fueling the fires of damage to joints and chronic inflammation, you'll never get an improvement in the problem. These are things that must be done. And quite honestly, there's a segment of people who would rather take a drug and just live with the pain than actually commit themselves to doing the physically demanding work of changing diet and lifestyle. People just don't want to change. They want to stay right where they are, just like the government. They just don't want to change. They would rather have the pain and just find some way to tolerate it so they don't have to do anything extra special. And that's a shame, because so many of the chronic debilitating diseases that we have in our world, in our country today, could be improved quite substantially if people would just change their diet, change their lifestyle, and add simple nutraceutical therapies to their lives. Well, do you have any questions? I'm sure you probably do, or maybe you think this is a bunch of hooey. I don't know. But if you want to talk to me, I'm available. My phone number is 972-496-9800. That's my office number, and my office is located in Garland, Texas. If you would like to come by and see me, I'd love to be able to sit down and talk with you about your particular condition. If you want to call and just ask some basic questions, I'm not saying I can diagnose you on the phone. I sure can't do that, but I sure can help you get the right direction to see if you can address the problems that you're having. This is Dr. Ronald Ritchie saying good health and have a great day.